and welcome to another episode of Right Brain Rounds. Today, I'm so very excited to introduce Dr. Lisa Tartaglia. Dr. Lisa and I went to medical school together. We studied together. We graduated way back in 2003 from medical school at the Lake Erie College of Osteopathic Medicine in Pennsylvania. And she is here today to talk to us about her new practice, concierge hospice practice in Florida. And I'll let her take it away.
Thank you so much for having me, Dr. Moeller. My name is Dr. Lisa Tartaglia, and as Dr. Moeller stated, I started my own business called Promessa Medical Consultants. And basically, it is a concierge practice where I make house calls, and I also can do telephonic video visits. So I have a way of conferencing families in from out of state. I work mostly within the state of Florida, but I am licensed in other states, but I have not branched out. I reside in Central Florida, which is very close to the Villages, which is a large retirement community with over 100,000 senior citizens. So primarily my practice is based out of there for right now. And my practice, basically, I take the time to spend with patients that are trying to navigate very complex medical conditions. And I developed this practice based on my career as a hospice and palliative medicine medical director. Oftentimes I would receive these patients into my hospice, and they were very unfamiliar of their disease prognosis. So I'm trying to now get these patients maybe 5 years or 2 years or even 1 year, maybe even 6 months before their end of life, so they can just be prepared for what to expect as their disease progresses. So I make house calls, and I spend an hour with my patients. I'm not like a true concierge physician in the sense of I don't charge an annual fee. I collect the fee hourly for the patients, and then they have access to me whenever they would like.
Sure. So you're like a medical consultant. You go and see the patient in their home, do a lot of teaching, manage their complex medical care, end of life issues, and provide that to them, kind of like on a PRN basis.
Yes, and I try to keep them linked with their primary care physicians. However, some of my patients, they're going in and out of hospitals a lot. And that being said, and I'm in the state of Florida, there's a brokenness in our system of going back and forth to hospitals. All of our hospitals are now hospitalist based. So oftentimes the hospitals will send them home from the hospital and say, follow up with their PCP, but they can't even get in to see their PCP for 2 months. So I will act as a PCP because I'm also board certified in family practice. I prefer just to be more in the consultant base, but I kind of am a jack of all trades and will wear whatever hat I need to fit the patient's needs.
That's really wonderful. I mean, I think in working in medicine for, the past 20 years since you graduated from medical school, you've had so many different experiences that you can bring to those people as a consultant in a very personalized way, and in a way that, you as the professional can, see patients on your terms. I mean, how has that changed your whole practice of medicine? I'm really interested in hearing that.
Well, as I stated earlier, I always worked for large organizations. My career was spent in various hospice organizations. And although I am in a certificate of need state, which means there has to be a lobbying platform to get hospices to open in the counties in which I work, in the state in which I work. So that means we have a pretty robust hospice.
Yeah.
There's still a lot of red tape that was involved in my career. And I worked from the very low level hospice physician when I first came out of residency, all the way up to running a program that was in 2 counties. And there is just a lot of obstacles because it's a huge monstrosity and it's a business. So it's not run by physicians or nurses, it's run by the business. And obviously, whether they're for-profit or nonprofit, I've worked for both. They're equally as challenging, and they're just as great, service. But for me as a provider, I'm able to show up authentically with my patients. There's nobody calling me, to ask for, what if there's a problem with a patient, for me to go counsel another physician on that patient and then emergently go out. There's no quote unquote emergencies that are created by the bureaucracy of a hospice organization, which unfortunately, as the medical director, I got caught up in a lot of that. And I was working 7 days a week and got very, very tired. And I felt that I was not able to show up to work in my best my best self. And I say authentic self. Now, when I go into the patients, this week I brought, a special treat for one of my patients that he's of Italian heritage like myself. And I brought him one of my Italian treats just because I felt like it. And I know he would appreciate it. And I can sit there and see him. And obviously, if I don't have another patient to rush to, I spend extra time with these patients, because sometimes I'm their only contact with the outside world because they're bedbound or housebound for that day. So I spend a lot of time and I joke around with my patients, and I really try to help them understand their disease process, help them strategize how to better take all their medications, and also eliminate medications that aren't needed. These are all things that I kind of, when I was working for a corporation, I was kind of squelched and not able to be my authentic self. And that's what I love the most about having my own practice.
Mhm. And, I often tell people, I have my own practice as well, that it's not a bad thing to work for corporations or institutions. And, a lot of times, medical students or residents, as they're getting trained and graduating from their, residencies or fellowships, that seems like the perfect route to go, is to work for corporate medicine, have a nice paycheck, regular paycheck, 401k benefits, all those things. And you are, going to work for someone else, all of that medical education that you just received. I mean, and it seems like there aren't any other options, at the end of your training part of your career. It seems like the thing to do, to go find a job being employed by someone, and what is the best, benefit that you can get from that situation. And I don't think that a lot of people, and maybe it's different now, 2003 versus 2023.
Mhm.
But, I often think about our young trainees and how they might not view starting their own practice as an option. What would you say to those people?
Well, it's interesting that you say that. I'm actually collaborating with a younger physician, not even in my specialty. And I've been meeting with him, trying to counsel him to help him go out on his own, because I feel that a lot of times in medical school, and I don't know that I'm sure the education has changed tremendously since we went to school.
Mhm.
But when we are getting educated, it's kind of inbred into us that you follow the path of least resistance, which means go into the big practice, work for corporate medicine, work, in an ACO, work in that realm, because that's where everyone else is, right? And everyone is miserable, right?
Mhm.
So it's hard to break that trend, to be a trendsetter and just say, you know what, like, it's not quitting. I'm going to try something different because I know what works. And I feel with the practice of medicine, it is a practice, and you can have a lot of knowledge, but once you are out there working in your field, you know what's best for your patients. They're happy. They're giving you good reviews, even if you're in the large practice. They all want to talk to you when they're calling the practice. They don't want to deal with your nurse. So I feel that as young physicians, we should not be paralyzed in the fact of not trying to do our own business. And I feel that we are, because there's very few like you, Dr. Muller, who went on to get an MBA and knew how to navigate the business portion of medicine, because that can be daunting and overwhelming.
Yes, and I often, feel like it's very important to put out there that, physicians often feel that they can't or they're not able to, adequately perform the business part of a practice. Although they've been highly trained in their specialty in medicine and have completed and survived medical school. And I think, that self-limiting thought that doctors don't have the ability to, manage or start their own practices, just needs to be really taken, we need to face that head on and say, yes, actually we can. And it's not as difficult as you might think it is. And you just kind of, in the long run, really you have to hire the right people or learn from the right people that went before you doing it, so that you don't make the mistakes that they made and that the process can be, really smooth. But like you said, a lot of times, knowing that you want this autonomy in medicine and getting there takes some experience. So like, it might seem like a daunting task to start your own practice, as you graduate from residency. So I can totally understand that.
Yeah, but I want to just add, like, for my practice is different, because it's just me, right?
Mhm.
So when I first had the vision, it was several years ago, and actually through COVID and taking care of my loved ones that were out of state. My sister-in-law lost her dad during COVID times, and I had to counsel my brother and my sister-in-law through his dying process. And it was very hard, because I wanted to be there to hold them, to hug them, to support them. I've known her father my whole life, just like I've known her for many, many years. We grew up on the same street. We're Italian. We're all stay close or whatever. So he's come to my home and everything. And during that process, I would kind of help my brother or my sister-in-law, whatever they call. They say, "Oh, today this is what's happening," and I'd say, "Oh, here," and I didn't even send them articles to read and then explain what to do next. And we would FaceTime. So after he had passed, my brother's like, "Okay, he's a business guy. He's IT." He's like, "What is it going to take for you to do this? Like, you could have an app and charge people, let's just say $75 for 10 minutes. And this is what I need to know." My brother was lost. He felt helpless with his father-in-law dying. They were not prepared, even though they had a hospice provider in. Unfortunately, my sister-in-law's dad died during the holidays, which is, in my opinion, the worst time to die in a hospice, because everybody's on vacation,
Yeah.
So they didn't have the good support of the interdisciplinary team, and they really trusted me. So I would be in Lowe's talking to them, because we were busy doing all this yard work at our house between the holidays, and FaceTime them and visit with her dad to kind of give them an idea of timing. And that's what kind of started it. My brother's like, "Yeah, you just need an app." I don't want to bore you with all the details, but I was just able to check off all these obstacles that in my head I thought were insurmountable. Like, "Oh, I can't do that. How am I going to do it?" I've never had an electronic record system. I'm embarrassed to say this, but as a physician for 20 years, hospices don't use EHR. We dictate all of our notes. So I was really that was like a huge obstacle for me to overcome, and I was like terrified, like, how am I going to do this? Well, basically our notes are very similar. It's a consultant notes. I know how to write a note. So I actually developed my own note and my own process for my electronic records. So it's very exhilarating when I check these things off the box. And I don't have employees right now, because I'm a mobile place. I do my own vitals. I do everything. And so I can do it all. And I have, my phone, my work phone goes to my regular cell phone. I know when it's a work call coming in, so I know to answer the call professionally. If I'm with a patient, it goes to voicemail. My patients are very receptive. They know I have a text feature that's a HIPAA compliant, so they'll text me. And it's interesting, Dr. Muller, I don't have all the calls I used to have when I worked in chaos for corporate America. because my patients are well taken care of. I had a patient just call me today. I gave them advice. And then at the end, she goes, I just hope you have a wonderful weekend. It was so great talking to you. I'm like, what? Like, it's still, I pinch myself. I'm so lucky that I went out on my own because I just love being a physician again.
Oh, that is such a beautiful story. And, you know, thinking about as I started my own practice and I have an answering service, the amount of times that people have called me on the answering service, I can probably count in the last 5 years, one hand, maybe two
Wow.
hands, the amount of calls that I've gotten on the answering service. And I do feel that it's because of that autonomy that you have and the time that you can spend with your patients that they know that a lot of their questions are answered. Like I'm not getting a lot of calls about questions after the patient has left. I kind of pride myself on taking care of those patients and sitting with them. And, sometimes there's bad news. Sometimes there's news that needs a lot of attention and explaining. Um, just as I'm sure that is the exact same thing with your practice. It really goes to show that you can take control of that by taking the autonomy you get when working for yourself and passing that on to your patients.
Yes, it's really true. I love the fact that I have the time. Every visit that I do is at least an hour.
Mhm.
And I really can do a deep dive. And being in patients' homes, you can see how they live, not out of judgment, but out of how to make their living arrangement even better for their quality of life. So I'm able to see what they're eating, what they're drinking, what their setup is around their chair or their bed, and what their activities of daily living are looking like because I'm there in real time. The other thing that's amazing is because most of my patients that have hired me to be their consultant, it's their out-of-state children that pay for my service because they can't be here with mom or dad because they have families in other states and it's just impossible. So I originally was doing like all these Google Meet meetings, like, having a meeting while I was there and everything. Now they're just happy with an email. Like I send an email like, today I saw your father and this is what's going on. And I summarize it and they're like, thank you so much. I appreciate you, because they know that I've built my rapport and they know I'm spending the time with their loved ones, trying to help them.
That is just, again, so amazing. And, to bring the joy back into practicing medicine, it is very important, especially after a pandemic and when so many people are experiencing, symptoms of burnout in medicine. Or feeling underappreciated as physicians, just really kind of getting back to kind of old school medicine, where people would do house calls. I mean, house calls are cool again.
Yeah, exactly. Yeah,
And
and in
yeah,
the villages, they go around with golf carts. When you come to visit Florida, I have to take you up to the villages because we're getting
oh,
closer to
please.
that age group.
I so would love it.
Yeah, and so they have golf carts. So my dream, or one day I will have, is my golf cart with my Promessa label, and I'll be zipping around in my golf cart. Because I swear to you, I do marketing in the villages, and I market at the golf club. They're like, "Can you meet me at the club after 9 holes of golf?" And my ladies' club is meeting, and it's a support group. And I go and meet and talk to them about my business. I mean, it's so neat to be up there. They're a very well-educated group of seniors, and they want to take control of their health. They also know how broken the system is, and because they can't get in with their primary, and it's not the physician's fault. I want to make that known, make that clear when I'm saying these things. It's because as physicians, we've allowed corporations to take over our practice of medicine, and we need to swing the pendulum to the other side, but I'm not sure how that will happen.
Yes, and I've always been, someone who says that physicians need to take the practice of medicine back into their own hands. Um, I also think that the insurance middleman situation is very dangerous to patient care and approval for, things that are necessary, and delays in patient care, appropriate patient care.
Yes.
And, you know, seeing you doing this without the involvement of any insurance is just also really enlightening, you know, that people can do this. You can go out and practice medicine on your own terms and make your life a lot better
Mhm.
and make the lives of your patients even better.
Yes, and signing myself off of Medicare was the biggest and the hardest step I did. And I'm very superstitious. Dr. Muller knows this because she used
Mhm.
to study with me. So I had to do it on a day, that was my favorite numbers to sign over the affidavit paperwork. So what that means is for 2 years, I cannot opt back into Medicare. And obviously my bread and butter as a hospice provider is Medicare, right? Because they pay the global fee for hospice. But I also know in my heart I will not be happy just going back to doing hospice. I've done it for 20 years. I feel like I've worked in every angle of it. I don't feel like, I need to get back out there and be hustling. And then, when I speak to my other colleagues that are hospice and palliative medicine providers that still work for local hospices, they're like, all joking aside, they would still take you. They just wouldn't bill under your NPI or your Medicare number because I wouldn't have one. So the reason I'm sharing this story is in my mind, I put all these obstacles in my head as to why I couldn't launch my business appropriately. And then I realized it was all me that was stopping my business. So once I signed that affidavit, it was very liberating. And then all of a sudden, I started getting patients, and I'm the one that takes the calls, right? So I'm the one that tells them their fee. And even now I get a little uncomfortable, like, oh, this is what I charge. But in the grand scheme of things, there's very few that are like, oh, no, I don't want to pay that, because the reason why is their loved one is very sick and they need answers. Like, they've been discharged from the hospital. They have no follow-up. They have no prescriptions. They're in a bad state of affairs. So they know they don't want their loved ones back in the hospital. So they're willing to pay my fee. And quite honestly, my fee is less than what I paid a plumber to come out and fix a toilet that my son clogged 2 weeks ago. So it's not that ridiculous, if that makes sense. So I think as physicians, we don't think we're worth our fee.
Mhm.
But if you ask my husband, he thinks I need to be charging more. But it's all trying to get the business right now. And I'm content with what I'm doing and what I'm billing. And it's just nice to not have to deal with insurance, ICD-10 codes, and none of that stuff matters in my world, which is beautiful. It's liberating.
That is just fantastic. And, you know, I want the listeners to also know about, you know, when you're starting a business or a practice, a lot of times people have this ideal practice, dream practice in their mind. And, you know, I feel like in going back to the drawing board, like the initial thoughts of starting my own practice, I knew what I envisioned for that and what would be my ideal practice and what would keep me in medicine for forever, you know, for the rest of my life. And when thinking about your business, your practice, tell me just about how you named it and what those visions were and how it's just come to fruition that you're doing it now.
Yeah.
But like, how did it all start? Like, what does promessa mean?
Okay. Well, promessa means promise in Italian.
Mhm.
And for the longest time, I was held up on how am I going to name my practice, or what is it going to look like? And being that I live in Central Florida, I have a close proximity to the Disney parks. And this may sound very goofy, but the Disney parks during COVID were a sanctuary for myself and my other friend who's also a physician. And we would spend our post-call days with our sneakers on and our gym clothes, just walking the parks, not even to go on the rides, and just seeing people's faces going on the rides or whatever. And honestly, in the animal kingdom is where I came up with my that is where my whole business finally came to be. And I think it was, again, in doing a lot of personal development work within myself, I realized that, what's the most authentic thing of me? When anybody looks at me, they know it's my Italian heritage. Like, I'm obsessed with it.
Mhm.
So I immediately came up with promessa. And then I came up with a saying that hope is the last thing to die. And that was actually done with one of my friends who's married to an Italian. He actually helped me, like that would be my banner or whatever. And then I thought, well, as I started writing, my content for my website that was created by my younger brother, I did, an easy bio. That's easy to do. But then I wanted Promessa to stand out, because eventually I would like Promessa to be bigger than just me. And I want to make sure that there's a principle and a foundation and a mission statement. So my principle are 4 items that I feel are very important, that I've learned in the 20 years of doing hospice and palliative medicine, that there's a lot of these principles are not seen in my patients. Now, it can be because they did not want to hear the things that their physicians wanted to say. But I can say most of the time it's because the physicians don't have the time and they don't know how to do it. So my first principle is verita, which means truth. And I will constantly, reiterate to the patients, you let me know how much you want to know. But I will tell you this, in working with end-of-life patients, they want to know what the end of life is going to look like. So my guarantee is, if you choose to be a patient at Promessa, you will get the truth about your illness. And I can sugarcoat the truth. I can make it nice and be very rainbows and unicorn, or I can be very blunt. And there's some patients, you get the read on them of how much they want to know.
Yeah.
The next principle is trust. It's fiducia. So trust is, they can count on me that I will be with them every step of their journey. I'm not only a consultant, but I can also guide them. I don't like the term that my brother gave me as death coach. I think that sounds morbid, but I can guide them through their journey of passing. And I will be there to they can trust that I will be there. And I always tell my patients, day or night, guys, when you really need me, I'm going to be there. If you want me, I will be there. Speranza means hope. You never want to give up hope. But we also have to have an interpretation of what hope should look like. So hope for somebody that's a stage 4 cancer patient that stopped eating and drinking and is no longer walking looks a little different than a stage 4 cancer patient that's out going to the Disney parks with their friends and family, still eating and drinking. So we have to re-identify the meaning of hope and the interpretation of hope. And I really like helping families readjust that. It's more the families than the patient, because sometimes families don't realize they inherently shame the patients when they're like, come on, keep fighting, work harder, try harder. They are sick. They are filled with illness. Imagine you being sick. Like, go easy on my patients. So I'm a very much a patient advocate. And then serenita, which is serenity, is that my goal is to create peace and serenity. And that is my goal with every treatment plan. So I have lots of tricks of medications that we can use, but a lot of times it's also, there's not just physical pain, there's emotional pain, there's spiritual pain, psychosocial pain. There can be a lot of unfinished business, and I will work with the patients to help them. And then also bring in people that I know could benefit them if I know that it will be helpful for them to meet with. So that's my 4, principles. And then throughout my website are pictures that I took in Italy. And, there's a picture in the mountain, and it's of the town that my grandfather grew up in. And he left that town to come to America. And without him, we would not all be here and be successful. So when I took my daughter there when 5 years ago, it was very, I don't know, it was different. I've been there a lot in my life, but this time it was very different. And, outside of his home, there was like a saying that you got to take a chance, and to get the life you want, you need to take the chance. And I thought it was kind of interesting that sign was there in English. And I took a picture of that sign, and then I took a picture of the mountains. And so that's on my website too. So I just made my business for me. And it was the first step of healing from the trauma of working in corporate America and corporate medicine. And I make all of my marketing materials. I embody everything that is processed through my business. I'm lucky because my brother, like I said, is an IT junkie. So he did my website. My niece did my emblem, it's just been a work of love. And it all started at the animal kingdom. Like, we were outside of the ride at Avatar just brainstorming, my friend Sarah and I was like, it's Promise. That's the name, Promessa. So, and then it just went on and on. So it's been a beautiful healing process.
I just love that story. And, kind of going back to like the business of medicine, and starting practices, a business plan a lot of times is needed. Like, people who write their goals down, put things in writing, are 42% more likely to achieve those goals. And without a business plan that has a mission statement or a vision statement for your business, and then thinking in the end, like, what do you want the legacy of your business to be? Like, what is the exit plan? I mean, these are like essential core things that are needed for a business plan. And so, I kind of like seeing the flow of a business plan and how you thought of the idea of how to name your practice, the core principles of your practice, and, helping other people with their legacy, because it's the end of life, and teaching them, educating them about what is about to happen from your experiences, and helping people in these end of life, things that they're going through, and their family members. And, this kind of allows me to pivot to how you're just a lifelong teacher, an educator, and you're doing that, not only with your new job that you're going to be starting in teaching at a medical school, but also in your podcast or the YouTube channel that you have called You Only Die Once. So it's all amazing. Tell us about the YouTube channel.
So the YouTube channel came from basically my friend Dr. Bone and I call Dr. Bone, no matter what your religious beliefs are, she's my Holy Spirit. So she was a guiding light. I moved to Central Florida, like I have told you, to become a hospice medical director at a large for-profit hospice organization. And I'm very grateful to them for moving me to Central Florida, because I love it here, and my family has evolved significantly from being here. We found our people. I feel at home here for the first time in a long time since I moved to Florida. However, what was interesting is when I needed an associate medical director. So I hired Dr. Bone, but she had to finish out her contract with her other employer. And it was a long process to get her on board. And it became a little bit frustrating for me that I was drowning and they didn't see the significance of hiring someone. So when she came on board, we only worked for 60 days together. It's hard to believe, but she had spent months prior to coming on board, weekends at my home. I was showing her the ropes of what it was like, and she was kind of learning the job behind the scenes, waiting to take over the position. When we worked together in those 60 days, I always would say, after we're done every time after you're done meeting with the family and patient, and I'm not sure how it is for you, Dr. Muller, because you do deliver, bad news in your profession. I work in an interdisciplinary team. So a lot of times we emote about, can you believe that? Oh, what a story, blah, blah, blah. And it's a very healing process. We don't say it out of judgment, but we're always, like, oh, you have a lot of aha moments, because sometimes you have a lot of preconceived notions when you go in to see patients and families, or at least I do. So what Dr. Bone and I have noticed is a lot of times patients are very uneducated on their disease process. It's not something that people want to talk about because it's shameful. Dying is, almost like a sin, but it's actually a natural part of life, of living. So we started jotting down topics of what we think are important topics to talk about. And we meet, monthly. Now we haven't met in quite some time because we've both been traveling, but we meet monthly and we develop our curriculum, I would say, or our lecture series. And we both tag team of who's going to write, whatever lecture. And we do series of talks based on end of life care. And our goal is to empower patients and especially families to have knowledge. And what is interesting is one of my patients, I don't talk about my YouTube channel at work. And one of them found me on YouTube and she's like, oh, instead of calling you or texting you, I tune into your video and your voice is so calming. And then it makes me realize it's okay. Mom's going to be okay. So I think it's really, interesting. I have received patients from my YouTube channel because they reach out, will send us emails. And then I will say, if you'd like a consult. And I have helped a couple of our viewers, which has been really phenomenal and so neat to find that they're searching on YouTube and we're able to help them. And it's just, again, another part of my healing and a great way to work with a colleague, because I think in medicine, at least in the area of medicine I worked in, even though there's a team, there's always the doctor and the team, and the interdisciplinary team consists of nurses, social workers, chaplains, but I never felt a team within the physicians. I tried to create it in my team when I was in charge of the team in Lake and Sumter, and I think I did a pretty good job, but you never felt supported by another colleague. And I feel that again is because our business is consumed by metrics and competition. And sometimes people don't want to be part of your team. And it's very interesting because with Dr. Bone, she's a little bit older than I am, and she's much more wiser, and she's helped me so much. And this doing the channel has just been so fun. We love it. And now we're not only on YouTube, but we have some of our videos made into podcasts. And, our name is getting out slowly but surely. We want it to grow organically. And I feel like, there's something to be said to talk about these topics openly.
Yeah, so everyone tune in to the You Only Die Once YouTube channel with Dr. Sarah Bone and Dr. Lisa Tartaglia. And if you have somebody else who's going through an end of life situation where they need advice on, how to deal with, having a family member die at home,
Mhm.
how does the family deal with that? How does the patient deal with that? What do you need to prepare? What kind of questions you need to ask in your own life? I think that is the kind of guidance that the topics that you and Dr. Bone talk about on your podcast and your YouTube channel that can really help people. And it's not medical advice. It's just good old fashioned experience from being a caring and compassionate physician team, caring for people at end of life and what to expect. And I always tell people, they're going into labor, they're pregnant, they're getting towards the end and they've never had a baby before. And, I tell them, ask questions, when you go in for labor, make sure that you're asking questions and that you're not in the dark about what is about to happen, and take prenatal classes and Lamaze classes and classes on how to change the baby's diaper and, all of those things. And, you have it, it's right there for people. I mean, it's such a valuable, resource.
Yeah, thank you. I mean, it's sad because in our patient population and my patient population in Promessa, so many of my patients have no idea the globalness of their disease, of what their disease trajectory looks like. They just know the bits and pieces, and it's very hard for them to ascertain a global view, just because they do get bits and pieces from their various physicians. So I try to say, our channel gives an overview, and it's not it's just more of us bantering back and forth. And recently we did this whole, we broke down every illness and just said, this is what it looks like, because I can't tell you how many people don't even realize that they do have a serious illness, and we just feel like, you should know, because our patients that come to hospice and have 72 hours to live, that's a disservice. They should have known before, so they could have their affairs in order and they could die peacefully, because those patients that don't have the time, they're not able to have the closure for their end of life journey.
Well, and I think about people who are preparing, again, for labor, as all of my patients are pregnant.
Mm-hmm.
And, the people who come in with a birth plan,
Mm-hmm.
like, do you help people with a death plan?
Well, yeah, for me, I wouldn't say I do a quote unquote death plan, but
Yeah. I mean,
but I know, okay, I know if my patients want to die in their home. I know who they want there when they're passing. I have one of my dear patients is now in the process of declining. He's taken a major decline, and I've started to prepare his children that are out of state for his passing, and also start to prepare him of what it's going to look like. So you do have to know these things. The other thing is, obviously, living will is really big for us. So like our death plan, I guess, would be like knowing who their healthcare surrogate is when they can't make decisions on their own, who will make the decisions for them. And then I openly ask them, like, what do you want? What do you want this to look like? Like, some of my patients are not do not resuscitate, but they want to be resuscitated if they're going to come back alive, well, eating, drinking, having their shots of scotch. Well, that doesn't happen. So when that gets to that, what do we want it to look like? So I do, I guess, really help them with a death plan. I never really looked at it as that, but I do kind of help prepare and guide them through that process. What is so interesting to me, Dr. Moeller, is some of my patients are on hospice services. I mean, I've referred them to hospice, and then I figure, okay, well, good luck. Let me know if you ever need anything. And they're like, no, Dr. T, we don't want to lose you. We still want to pay you to come see mom or dad and make sure they're, doing right by them, because we don't know what that looks like. So I'm just blown away that I am, able to collaborate with hospices in the community and work, side by side with them to make sure the patients are at peace when they're passing. So it's pretty cool.
Yeah, that's just so beautiful. And, when you think about the end of life, I mean, how many people would you say actually think about what their desires are in the end of life, as far as like, where do I want to pass away? How do I want to, what kind of things would I want to be resuscitated for? I mean, do people honestly have these kind of conversations all the time before seeing you?
No, oftentimes they don't. I mean, oftentimes you'll when I see my patients, I'll say, I have to ask you a couple questions, do a whole goals of care, rubric that I that I have this whole thing that I discuss. And a lot of times they're very defensive. Of course I want everything done. Oh, you're just looking at me because I'm old, and they're very, very defensive. And it's because they've come out of, XYZ hospital over and over again. They can't get in with their, back to their specialist for 3 months. And, some of their loved ones were like, by 3 months, they'll be dead, or they'll be back in the hospital. It's like very dramatic. So they haven't had good conversation. Because even though, like, when we were itty bitty doctors, like when we were in training, that was a big thing to like get that DNR signed. And the reason why I know it is because I was the one in my little residency program that was always, Miss Little Do-Gooder, like, let me get that yellow form DNR signed, because I wanted patients to know how sick they were. And my attending was like on us, like, did you have a goals of care discussion? But still, I'm shocked in 2023 how it's just blown by, and you don't look at, patients, patients that are in the hospital that are critically ill. I mean, currently have a nurse of mine who I go into a building, and she's telling me her story of her brother, just like, well, we signed a DNR because they're taking him back to surgery for the 7th time in 3 weeks. The other surgeries, he's been left open, his abdominal cavity is open. So like a layperson, you hear all this. And we told them, if he doesn't make it through the surgery, just let him go. But if he does make it, then that's God's will. And we'll put in the trach and he'll go to a long-term care facility. And I had actually talked to her. I said, do you really think that that's what your brother would want? Like, we always have to have discussions with our patients and families of what would they want if they could talk to you now, what would they be telling you? It's not what you want to hold on to what you thought was their living, because their living has totally changed. What do you want? So these are the hard conversations I have. And again, being in the home, it's easier than being in a sterile office. And I don't just dig right in. Sometimes I don't have the conversation for 2 or 3 visits because I have to develop rapport and trust with the family. So these are the kinds of, conversations that I focus on, and any hospice and palliative medicine physician should be focusing on, and any geriatrician for that matter should be focusing on. And quite honestly, like in You Only Die Once, we say, I'm a do not resuscitate. I'm 49 years old. I'm healthy. I do not ever want to be resuscitated, no matter what the case is. So everyone should really know what they want. And it should just be as important as a birth plan. But unfortunately, it's not, because there's just a stigma of death being final, and people are afraid of dying.
Yeah. I mean, I can think of, the feelings that I have. It makes me feel a little bit anxious,
Mm-hmm.
thinking about that and verbalizing what I would want, in end of life, like at age, 46.
Mm-hmm.
And yeah, I mean, I would definitely, feel uncomfortable having those conversations.
Yeah.
But I mean, shouldn't that be known? Wow. Yeah, I love that you are able to kind of get those kind of conversations going with the experience that you have in a way that will prompt, a lot of thinking.
Yes. And that's what my goal is as in Promessa. And then also that's our goal with You Only Die Once, is just to have those light bulbs go off, and then you can be more empowered by your choices, because it's ultimately your choice. It's not the physicians. And that's what I look most forward to with teaching, when I start teaching in July, to teach the medical students, because I have to tell you, when I started this, my journey was the way I practiced medicine was so different, because it was a lot of what I thought should be. And you have to really separate yourself of, this is not your loved one, this is their life to lead. So, and work from a place of not judgment. So even, the nurse that just, nonchalantly is walking me out to the car, telling me about her brother, I wanted to shake her. I have to be honest. I was like, I wanted to shake you. I want to shake you, but I can't shake her. She's a sweet girl and she wants her brother to live. So I just said a couple things, and next week when I go, I'll say a couple more. And I know that she's going to lean on me because she's opening up to me, and it's okay. If he gets a tracheostomy, if he goes to a long-term care, that's okay. And I had to learn that it's okay. You don't have to shake your patients. So I was sometimes say like, oh my God, I want to shake them. What's wrong with them? But I can see things more clearly just because I know I've been around dying a lot. And like I explained to you with my gentleman that's beginning his journey, I said to his daughter, I said, look, your husband's a physician. You could tell him what I'm telling you. He's probably going to say that's hokey. But I'm telling you, I've done this for 20 years, and this is what I see with this, and this. And, it's up to them to accept it, and they don't have to. And what I've learned is that's okay. So even in my business, I I just am able to walk away and not take things personally and do a lot of inner work with myself to prepare myself. And I, shared this on You Only Die Once. I always look in my mirror, like I flip my makeup mirror on, obviously I always have my red lipstick. That's my signature, but I do mirror work before I go in of how I show up. I leave, that my car wouldn't start, my kids left their lunch at home, who failed their test, who destroyed my house, whatever it is, whatever that's bothering me in my personal life, that is left, in my car. Because when I go into someone's home, I'm present. I'm, Dr. T, I'm with Promessa, and I'm going to help them. And none of that stuff plays a role. And I don't answer my phone when I'm with patients. It's very important to just be connected to them, because this journey is sacred. It's not easy for them.
Wow. Well, I hope you're around when I need end of life services. That is just, again, beautiful.
I hope I never, ever, ever have you as my patient, but if God forbid, I will be there for you, my love. But I never, ever, like I always say, I'm the type of doctor you never want to see. But if you do, I will take good care of you.
Phenomenal care. I am 100% sure. Yes. Yeah. So, Dr. Tartaglia, in closing, you had a quote about hope. And I just want you to put that out there and what it means to you and your patients.
Sure. My quote is, hope is the last thing to die. So that being said, is we never want to lose sight of hope, no matter what your hope is. You may not achieve, the cruise around the world with your terminal illness. You may not, live to see your granddaughter get married in 2 years, but there is hope. There's hope for today. And we have to live each day to the fullest and redefine your hope and how you could be present at that granddaughter's wedding or graduation that you will miss. What can we do today to fulfill your cup? To know that your legacy will live within your family forever. And that's what I always tell my patients is, no matter what, their legacy will live within you forever. Because I know for a fact, I've lost family members, and there's mannerisms and behaviors and sayings that I have that were said to me when I was a kid, and they've no longer been on this earth. So I truly believe, that hope really is the last thing to die. And even if you're faced with a terminal illness, chronic illness where there is no cure, don't lose hope, because there is a way to live a good life with this life-altering disease. You can live a good life, and you can be symptom-free and learn to live with the illness and not let it define you.
Well, that again is just truly amazing. And, this phenomenal doctor, Dr. Tartaglia, I'm proud to say that we trained together in the early years.
I'm so proud to call you my friend. It takes one to know one, my friend. And I want to just say to all of you that are in this podcast, if it wasn't for Dr. Moeller, to take all my crazy text messages and all my not good enoughs that I would text you and you would turn it around at me, I don't think I would be sitting here, because I just want everyone to know in the audience that I recently left another job. I took another job because I was uncertain of my career path. And with that transition of the job, I had to lean again on Dr. Moeller. I'm very lucky. She's my friend, but she's a phenomenal coach and will help guide you in your business. And once I contacted you, Karina, like everything has just gone forward, and it's just been amazing. I feel so happy, and I'm so lucky to call you my friend.
Yes, we're fast friends, forever friends, and I love it. And I'm so happy to call you my colleague. And just contact Dr. Tartaglia if you have any end of life questions, issues. Check out her YouTube channel, and never give up hope.